Hi, I'm Billy. I'm going to be working with you today.
Okay.
So what we're going to be doing is we're going to be assessing your posture, your standing posture.
Okay.
And we do that just so there's been studies done that show that bad posture increases pain down the road, and it's just better all around for your functioning day-to-day activities. So we're going to assess your posture. What I'm going to use is called a plumb line. It's a line that goes straight up and down. That helps me assess where your body is compared to where it should be.
Okay.
So I don't have a string or anything that hangs from the ceiling. So what I'm going to use is this line on the door frame.
Okay.
So the first thing I want you to do is just stand like this. I'm going to be over here looking at your posture.
So I'm standing so that I'm
Yep.
facing this wall.
Face this wall right here. And I'll get you lined up. Can you put your hair behind your ear for me?
Yes, I should.
Perfect. Take just a little step forward. Tiny step. Okay, good. We're pretty much in line. So what I'm looking for right now is my plumb line should be going through your earlobe,
Okay.
then your acromion process, which is right here, and then it goes through just posterior to your hip,
Okay.
anterior to your knee, and just in front of your ankle. So those are the things I'm looking for right now. So just
Okay.
keep looking straight for me. So you have a little bit of a forward head posture, which is very normal.
Okay.
We find that a lot in people who, read a lot or on the computer a lot. Looks like your shoulders are a little bit back.
Is that good or bad?
It's okay.
Oh, okay.
It's okay.
Okay.
Let's see. Okay. So you're good that way. So now if you can face the wall for me, face the door. Can you move over a little bit to your right? Oh, a little bit too far. You try to line your nose up right with that line for me. Perfect. Yep, you look good. All right. So are you right-handed?
Yes, I am.
Okay, I can tell because your right shoulder is a little bit lower than your left, which hand dominance normally shows us that. Like if you were left-handed, your left shoulder would be lower. My plumb line when you're facing this way is pretty much going straight down your body, going through your, we call back of your head, which is your occipital protuberance. It looks like it's cutting straight through, perfect on your trunk and through your legs. In your past medical history, you had a stroke, correct?
Yes, I did.
And it affected your right side?
Yes, it did.
Okay. I can tell a little bit because your right foot faces outward a little bit more than your left. That's probably a little residual from when you had your stroke. Other than that, look pretty good. Your right hip might be a little bit higher than your left, but overall pretty even. So now if you can just face towards me, turn around. All right, move a little bit to your left, or to your right, I'm sorry.
Okay.
A little bit back. Perfect. Okay, let's see. Again, we see the shoulders. Elbows look good. Hips look good. Your knees look like they come in a little bit. We call that genu valgus.
Okay.
There's a few stretches and things we can do to try to improve that.
Oh,
There could be a few things causing that. One of them is tight IT band. So we're going to do a few stretches, or a stretch to try to stretch that out a little bit. It might help. Other than that, you look pretty good. So the first thing we're going to do a few stretches.
Okay.
First, I'm going to focus on your neck. I told you had a forward head posture.
Right.
In order to fix that or pull it back a little bit, we're going to do a neck stretch.
Okay.
With your forward head posture, the back of your neck is really tight. So
That's true.
we want to loosen up those muscles. So what we're going to do is we're just going to slowly pull our head forward, like bringing your chin towards your chest.
Like this.
Until you feel it. You should feel it right in the back, right back here. You're going to hold that for like 10 seconds. And then you're going to come back up.
Come up slowly, or?
Either way, whatever's comfortable. Just relax, just neutral. Then we're going to give you a little break. How's that feel?
I can start to feel.
Feel the stretch?
Yeah, yeah.
Good. So what we're doing when we stretch that muscle is loosening it up. So hopefully your neck is going to slowly move back to where it should be.
Okay.
Okay. So let's do it one more time. Bring your head down slowly until you feel that stretch. Perfect. Hold that. Good. Come back up. Perfect. So something else we would do for the forward head posture. I told you your extensors, the back of your neck is it's really short. That's why we're trying to stretch it out.
Okay.
The front needs to be strengthened. It's weaker. That's why your head's going forward. So I don't have a TheraBand with me right now, but what I could do to help you strengthen the front muscles here is I would put the TheraBand around your head, and you would just move your head back like this, and there'd be resistance.
Oh, okay.
So,
okay.
So maybe next time we work together, I can bring a TheraBand and we'll try that out.
Okay.
Without the TheraBand, it would just be a stretch, and that really wouldn't help you too much. So,
right.
So we'll just move on.
Okay.
The next thing I want to do. Next thing I'm going to do is I want to stretch out your lateral neck flexors, which we just did forward and backwards. Now we're going to go side to side. One other thing I noticed that I forgot to tell you was that the left side of your face is a little bit lower than your right side.
Okay.
And that's not because of the stroke or anything, but well, it might be because of the stroke, but it's not like a drooping. It's more of like a, like you're bending. So your left side is a little bit lower, so that means your left side is tight. So we're going to stretch that side out.
Okay.
So what I want you to do, watch me first.
Okay.
So we're going to stretch your left. So we're going to pull our right hand up, and we're going to slightly pull our head, try to put our ear on our right shoulder. Perfect. Just pull lightly. You should feel a stretch right in here.
Yeah.
You feel that?
Yes, I do.
Okay, let's hold that for 10 seconds. Is it a good stretch?
Yes, it feels great.
Good. Okay, relax. Now let's do the other side also, just to even out. Yep. Perfect. Try to have your ear touch your shoulder. Don't want it to hurt though, just where you can feel the stretch.
That feels great.
Okay, relax. Good. Let's do both sides one more time. Perfect. So hold that there. Good. Let's do the other side one last time. Alright, relax. Perfect. So you can do these stretches throughout the day. You can't stretch too much. You're not going to hurt yourself by stretching or anything like that. If it feels good throughout the day, you can just, do them whenever. The only time you want to stop is if it does become painful, or that's really the only reason. But like I said, you can't stretch too much. So we have one more stretch to do, and it's going to be for that IT band I was talking about.
Okay.
So I'm going to sit on the floor, and I want you to watch what I do, and I'm going to explain it.
Okay.
And then I'm going to have you try it.
Okay.
So I'm going to have you sit with your legs out in front of you.
Okay.
Your IT band looked like it was tight. It could be tight on both sides. So we're going to do this on both sides. You're going to cross one leg over. You want to make sure that foot is flat on the ground.
Okay.
And then you're going to twist and try to look behind you on that same side of the leg that's going over. And you should feel
Like a tightening
You
right
should
here.
feel a tightening,
Okay.
a stretch right here on the side of your thigh. So you're gonna do that. Try to look behind you. Make sure you keep your foot flat on the ground. You're gonna hold that for 10 seconds. Then you're gonna come back to neutral. Do the opposite. Left leg over your right, and then twist towards your left. And you'll hold that for 10 seconds.
Okay.
So, let me see. You can do that.
Okay.
Okay.
So I'm going to take this leg, go
Mhm.
like that,
Yep. So if you're doing that leg, you want to twist to your left.
to this,
Yep.
like this.
Yep. You're trying to look behind you. Make sure you keep this foot flat on the ground. So don't twist too far where that comes up. You should feel it right here on the side, from here all the way to your knee. Can you feel it?
Yes. Yes, I
Okay, so hold that. Okay, good, relax. Let's try the other leg. Now you're going to twist the opposite way.
can. Well, this one's harder.
This one's harder, that means this one's a little bit tighter probably. So that's a clue that, you know, that might be tight and that's what's causing
Yes, I can.
that postural deviation. Can you feel this one more coming through here?
Yes.
Okay. Alright, very good, relax. So, like same thing, same stretch like the others, you can do that throughout the day. I mean, it's a little bit harder position to get into. Let me help you out.
Thank you. Wait, okay. Come on.
Thank you for being such a great patient.
Oh, I'm trying to get up here.